like to thank everyone for joining the Duke Global Health Institute Think Global webinar, the first one for the spring semester. We're pleased to have an in-person audience as well as people on by Zoom. I'm Mary Story, professor in global health and community and family medicine. I direct healthy eating research, a national program of the Robert Wood Johnson Foundation that's based here at DGHI. Healthy eating research is committed to building a culture of health through identifying effective strategies to improve children's nutrition and prevent childhood obesity and food insecurity. Today's topic is hunger, nutrition, and food insecurity, challenges and promising solutions in the US and globally. Hunger and food insecurity is one of the most important global health issues facing us today and has only grown much worse with COVID. According to the most recent WHO and FAO report, roughly 800 million people in the world faced hunger in 2020. In the US, 1 in 4 households have experienced food insecurity this past year. Hunger and food insecurity have devastating effects on health and well-being. So what can we do to end hunger for good? And that's what we're here to discuss today. I would like to introduce our 3 distinguished speakers. Our first speaker will be Dr. Ed Frangello, who is professor and director of global health initiatives at the Arnold School of Public Health at the University of South Carolina. He's a leading expert and researcher in global food insecurity, measurement of food insecurity, and policy and programs for improving nutrition and development. He's worked extensively with WHO, UNICEF, World Bank, USAID, FAO, as well as other organizations on these issues. Dr. Frangello will address global issues. Our second speaker is Dr. Hilary Seligman, a professor of medicine and epidemiology at the University of California in San Francisco. She is a leading expert and researcher in US food insecurity and its health implications across the health course. Her policy and advocacy expertise focuses on the federal nutrition programs. She also directs the CDC's Nutrition and Obesity Policy Research and Evaluation Network, known as NOPRIN. Dr. Seligman will address the food insecurity in the United States. Our third speaker is Dr. Sarah Bowen, who is professor of sociology at North Carolina State University. Her research focuses on food systems, social institutions, and inequality, with a particular focus on the structural roots of diet disparities and food insecurity. Dr. Bowen is the author of Pressure Cooker, Why Home Cooking Won't Solve Our Problems and What Can We Do About It. Dr. Bowen will address racism as a fundamental cause of food insecurity. Each speaker will present for 10 minutes, and then Megan Lott, who is Deputy Director for Healthy Eating Research and whose background is in nutrition and food nutrition policy, will moderate a discussion for 20 minutes with our presenters. For those of you on Zoom, please put questions for presenters in the chat box, and they'll answer them during the question and answer period or in the chat box. We also welcome questions from people attending in person and encourage you to raise your hand during the Q&A. I'll now hand it off to our first presenter, Dr. Ed Frangello. Welcome.
Oh, thank you for having me. Next slide, please. So I was asked to talk about global hunger, nutrition, and food insecurity, and to, at the end, talk about challenges and possible solutions. So next slide. So we've seen in the news during the pandemic, food insecurity has been quite prominent. I've just given some quotes here from New York Times and Forbes. From Brazil, about 117 million people, or more than half of the country's population, face food insecurity, a leap from previously. Another headline about the US, UK and US food insecurity, 5 staggering numbers, giving some statistics about that. And then another quote entitled "America at Hunger's Edge." And this quote is very insightful. Food insecurity is as much about the threat of deprivation as it is about the deprivation itself. A food insecure life means a life lived in fear of hunger and the psychological toll that takes. Next slide. So that reflects the understanding that we've had about what it is that people experience when they're food insecure, that started with Kathy Radimer's dissertation work 30 years ago now, that told us that food insecurity is experienced in terms of a lack of quantity of food. On the top left there, compromises in the healthfulness or quality of food. And then on the right, the psychological components, particularly about experiencing uncertainty and also the need to make compromised choices. And then a social component, a social construct about socially unacceptable ways of getting food and eating in ways that are not seen as normative. Once we had this understanding, we started being able to measure food insecurity. And that allowed us to then understand something about its determinants and consequences. Next slide. And in particular, we've learned, going back now a little more than 20 years, that children in even marginally insecure households do poorly in many ways, in terms of their behavior, in terms of their physical and mental health, in terms of their dietary intake and physical activity, their social interactions, their academic performance, and whether they even attend to school, how they develop over time, hospitalizations, and obesity. And this is the data that have supported that these consequences exist, have really then prompted a thinking more deeply about what food insecurity is actually doing. So next slide. So when the National Nutrition Monitoring System, for example, in the US started in 1990, the understanding was that food insecurity, which is in the peach color in the middle there, operated through a nutritional path, which is shown towards the left there in the sort of greenish box, through dietary intake, nutritional status, and then that going to well-being. But what we've learned is that food insecurity is a profound stressor. It's not just a nutritional insult, if you like, but it's a profound stressor that results in the physical experience that we call hunger. It results in distress and adverse family and social interactions, in worry and anxiety stemming from uncertainty, and from people feeling deprived and alienated. And those all affect well-being through paths that are not strictly through the lack of food itself per se. Next slide. So when we look globally, we've had now since 2014 a measure of food insecurity that FAO, the Food and Agriculture Organization, developed based on earlier measures that started in the US, where they're reporting now on an annual basis or nearly annual basis the probability or the percentage of people, which is what's shown here, of moderate or severe food insecurity. And you can see, starting from the left, that in the world, it's been about a quarter of people, and it's been rising. You can see a jump in 2020, which reflects what we think is a temporary jump because of the pandemic. In Africa, you can see that the prevalence is much higher, above 50%. In Asia, fairly high, going into about 30%. And then way on the right is North America and Europe, which is in and around just below 10% in these statistics. Next slide. So that's food insecurity, but we're interested also in other measures of nutritional well-being. And so this is an array of some statistics about that that are coming from the same FAO report. I'll call your attention to the blue lines, the light blue lines, which is Asia, and then the orange ones, which is Africa. And then the dark green one, which is at the bottom of each graph, pretty much is North America and Europe and other very developed countries. So you can see here that whereas in well-developed countries, low birth weight rate tends to be about 5 or 7%, that in Asia, the blue, in Africa, the orange, it's much higher than that, coming down, but still far short of what it is in the developed countries. For stunting, which is children being short, that there's been dramatic declines over time, but still the rates of stunting are way much higher than they should be, reflecting the poor environments that children are growing in. The next graph, the third one from the left at the top, is overweight in children. You can see that in most of the world that hasn't really taken off yet. And then going to the bottom left is exclusive breastfeeding rates, where what we really want is 100% of children to be exclusively breastfed in the first 6 months, and you can see we're well short of that. Anemia rates for women of reproductive age remain alarmingly high, in the high 40% in Africa, and in other parts of the world in the 20 to 30% range. And then on the right, bottom right, is obesity for adults. And I think we all know that obesity rates have been rising, and that's true not just in North America and Europe, et cetera, which is at the top of that graph, but also in Africa and Asia at the bottom. Next slide. When we compare these prevalences to where we think we need to go, this graph shows two types of targets. The targets that came out of the World Health Assembly, which is the body that sort of oversees the work of the World Health Organization, and then the targets that are from the Sustainable Development Goal Initiative. You can see, again, moving from the left to right, that the low birth weight rates are above the targets, and the targets don't reflect where ideally we'd like to be. That for exclusive breastfeeding, we're well short of the target, which is in the light gray and darker gray there. And then for stunting, the targets are 12 to 15%, and we're still well above that. Wasting is at about 6.7%, and we're above that. And then anemia rates, we're nowhere close to reaching the target. Next slide. So this is just a reminder not to try to swallow all of the informations here, but if you look way over on the right, you'll see nutrition. And then if you look in the middle where it says food environments, I made a box around what corresponds to food insecurity. And the main point of this slide is that food insecurity and nutrition and what comes in between them and what precedes them comes from a complex system that we know describes how food is produced and distributed and made available and accessible to people. So next slide. So in the time that we're in human history, we are seeing that some of those drivers that were the ones that were really at the top of the previous slide of food security and nutrition are increasing in frequency and intensity. So epidemics, we're obviously have all experienced the pandemic as one example of that, but there's other epidemics that we see emerging, that have emerged in countries that we think are going to be more frequent. Conflicts are becoming more frequent. Climate extremes are obviously becoming more frequent. Economic downturns, and poverty and inequality is increasing rather than decreasing in the world. Next slide. So some challenges going forward are, first of all, about getting information that we need. The pandemic has exposed that we don't know how to get information rapidly during a crisis like this. We don't have a way of measuring children's experiences of food insecurity globally when we know that parents are inaccurate reporters of their children's experiences. We need to understand why those experiences are so detrimental for children and parenting, to develop effective, appropriate, and beneficial platforms for intervention that don't do harm. The usual reflex for food insecurity is to give more food, but often that's inappropriate because it doesn't address food insecurity as a stressor. We know that food insecurity intersects with other material need insecurities about housing, healthcare, water, et cetera, and we don't understand much about that. And we need to ensure the availability, access, and consumption of sustainable, healthy diets. In other words, we have to now bring climate in as a goal as well as health. And then finally, we need to accelerate progress to meet the targets that we've set out for breastfeeding, anemia, for stunting and wasting, and obesity. And then the last slide, please. So where are solutions going to come from? Well, they're going to come from familiar places in terms of poverty reduction and greater wealth equity, from using nutrition-specific interventions like fortification or supplementation or promotion of feeding. But we need to do that at much higher coverage than we've been doing, to have nutrition-sensitive interventions about agricultural livelihood, empowerment, integrating with child development, et cetera. And finally, to redirect food systems to produce and make available foods that are healthy for people, but also sustainable for the environment. And that's going to happen, and it has to happen by working closely with countries, because we know the social, cultural, and policy contexts are different in countries. We have to get food security, nutrition on policy agendas in those countries, emphasize the implementation of policies and programs that we know can work but aren't working to reach people. And then finally, we have to collaborate with climate change experts and actors. The field of nutrition is changing dramatically as we speak because of the need for the field of nutrition to start being part of the solution for climate change. And so we're going to have to integrate our efforts with climate change experts and actors. So I'll stop there and turn it over to Hillary.
Okay, thank you for inviting me to follow up that great introduction to food insecurity. I'm going to focus on food insecurity in the US. Next slide. And in comparison or consistent with what Ed just showed us in the previous presentation, in 2020, the USDA reported that about 1 in 9 US households are food insecure. Next slide. And this rate of food insecurity was similar to rates of food insecurity that we have seen in previous years. In fact, exactly the same as we observed in 2019. I want to call attention quickly to the fact that official USDA measures of food insecurity are conducted in December. And so I think what this is telling us is that by December of 2020, many of the policies that had gone into place to address massive increases in food security in the United States had likely had their effect, and food insecurity rates probably declined by December. This is not to say that there weren't persistent disparities. Next slide, please. Well, before we get to the disparities, food insecurity is not only common in the US and has been greater than 10% of all US households for decades, but also it is common in every state in the United States. It is easy to find food insecure people in every county, even wealthy counties in the United States. And so we really see this as a problem across our entire system. Next slide. The evenness in at least the December rates of food insecurity in the United States really obscures persistent and very dramatic disparities in food insecurity rates by race, ethnicity. And here you see the USDA's official numbers from 2020, where you see that Black, non-Hispanic, and Hispanic households have substantially higher rates of food insecurity compared to white households. Although we don't measure it in the USDA data, it is very clear that Native American households also have much higher rates of food insecurity, and Sarah will dive into that in a few minutes. Next slide. So as Ed indicated in the previous talk, high rates of food insecurity in the US, when we talk about this in the context of health and healthcare, we have to understand it in the context of an entire system and structure, whereby people who are experiencing food insecurity are also likely to have poor access to nutritious food, both geographically, it may not be available in the neighborhood, but also financially. We know that in the United States, many families perceive food such as fruits and vegetables as being luxury items. This and many of the other systems and structures that Ed just talked about mean that low-income households in general report less healthy dietary intake than higher-income households. And we know that these dietary patterns predispose people to chronic disease. And this is a big issue in the United States. Poor diet is the #1 cause of death in the US. It contributes to cardiovascular disease, cancer, diabetes, and obesity, making it a primary driver as well of healthcare costs. Next slide. Now, one of the things that we have to understand about food insecurity and health in the United States is that they probably have a very complex relationship. And one of the ways that I like to understand this is in this bi-directional relationship, where we know that food insecurity increases risk of poor health. But we see food insecurity being associated with poor health across many different dimensions of health, some of which are related to diet and some of which are not. So how do we understand those associations between food insecurity and those diseases that are not related to diet? Well, some of it probably goes back to the stress and anxiety and worry that food insecurity causes in a household. Some of it is also probably related to the high expenses that are related to being in poor health in the United States and abroad, where poor health increases healthcare expenditures, may limit employment opportunities, and as household income falls and competing demands rise, food insecurity rises. And so what we see in food insecure households is this cycle whereby as particularly the primary money earner in the household develops health issues, it becomes increasingly likely that the household will experience food insecurity. We also see this, of course, with other people in the household having disability or chronic disease. Next slide. So I'm going to spend the rest of my time just talking about some of the programs and policies that are in place in the United States to address these issues and where we have seen success and where we have a ways to go in order to really maximize their impact. And the first place to start, of course, in these conversations is SNAP, the Supplemental Nutrition Assistance Program, previously the Food Stamps Program. There has been abundant research now, particularly in the last few years, that shows what I consider definitively that SNAP not only reduces food insecurity, but also improves health outcomes, reduces medication non-adherence, and reduces healthcare expenditures. It is very clear that SNAP, therefore, has an impact not just on food security, but on downstream health as well. WIC is for pregnant and postpartum women and children under the age of 5. And similarly to SNAP, there is good evidence that WIC improves dietary intake and health outcomes, as well as childhood academic performance. And one of the things about childhood academic performance is that it is also a predictor of long-term health outcomes. And so, you know, we really, I think, have to think about these federal nutrition programs like SNAP and WIC as being our primary defense against food insecurity in the US. In recent months, over the course of the last 2 years of the pandemic in particular, we have seen some real successes within these programs, One is higher benefit levels overall within SNAP, higher benefit levels in particular for purchases of fruits and vegetables within WIC. We've seen reduced enrollment barriers, some of which were put into place for social distancing, but we've learned some really important lessons that I think will persist as the pandemic hopefully comes to conclusion soon. And then there's been a number of online and other technological advancements that have made these programs easier for people to use. Next slide. Then there's also tremendous momentum towards what we call food as medicine interventions. Food as medicine interventions are the integration of specific food and nutrition interventions in or in close collaboration with the healthcare system. And they usually target people with or at high risk of serious health conditions, such as people with cancer, people with HIV, people now with diabetes is a very important target population, often prioritizing people who are experiencing food insecurity. Next slide. This is the universe of food as medicine interventions, and you can see next in the box there are those types of programs that we consider traditional food as medicine programs, those that are implemented on site in a healthcare setting, like a food pantry in a clinic or a mobile food distribution in the clinic, those that are implemented out in the community, that you get a prescription from the healthcare system to receive, for example, medically tailored meals or medically tailored groceries, a referral to a food pantry or a produce prescription. And then if you can also think about a clinical referral to the federal nutrition programs as a food as medicine intervention. Next slide. As a whole, these food as medicine interventions have shown some really good preliminary data towards their impact, particularly with medically tailored meals, which have been shown in really high quality studies to reduce hospitalizations, lower medical costs, and improve medication adherence. And there's a lot of emerging research on the other types of food as medicine interventions. Even before that research is really here, we've had dramatic recent scaling. There have been new funders coming into the picture. And in particular, the USDA has invested heavily in financing nutrition incentives within SNAP, but produce prescription programs in particular that link, again, like a food as medicine intervention, link an intervention for a food insecure household with the healthcare they receive. Next slide. There are challenges though. Most of these interventions are not sufficiently scalable to have a substantial impact on population-wide food insecurity, even though there's so much interest in them. Why? At this point in time, they're often funded by short-term grants. They're often implemented with the goal of demonstrating a return on investment, which means they're targeted towards the most high-risk population. And so we are again investing upstream in the most ill people and de-investing in prevention. It's often limited duration of time that people have access to the produce prescription program or other food as medicine intervention. There's still a very fragmented and difficult to access social safety net, and the priority populations often change. Next slide, I think, is my final one. And then there are, although there have been tremendous successes within the federal nutrition programs as a result of the pandemic and an administration that really believes in the value of nutrition, there are some challenges regarding what we philosophically want to allow through federal nutrition support. Is it any foods or just access to healthy foods? It is clear that federal nutrition benefits are not sufficient to make families who enroll food secure in many cases. The dollar value of the benefit is too low. There are persistent difficulties in enrollment and bureaucratic systems that are not centered on what clients need. And there is particularly a lot of stigma and fear in particular populations about registering for a government program. For all of these reasons, there's been a real emergent interest in this field in examining universal basic incomes as a strategy to address food insecurity in the United States. With that, I don't want to leave you on the challenges, but I will turn it over to Sarah now and hope to come back to some of the successes afterwards.
Thank you very much. I hope this presentation will complement those two great presentations that we just heard. Next slide. So as we've heard, food insecurity rates in the US have remained persistently high over time, and they're also higher than in most other wealthy industrialized countries, although importantly, lower than in many countries, as you heard from Ed's presentation. Next slide. And we also know there are huge racial disparities in rates of food insecurity, as Hillary mentioned, with Black and Latinx and Native American families and households experiencing food insecurity at rates that are more than double that of white households. Next slide. So how do we explain these two things? We have lots of research on pathways, and some questions remain unanswered, but we know that, not surprisingly, food insecurity often goes hand in hand with other forms of material hardship and poverty. Although importantly, they aren't synonymous. Many poor families remain food insecure, and sometimes wealthier families experience food insecurity. There's also research showing that food insecure households experience more negative life events, and that they draw on fewer resources and lower levels of social support to weather these crises. And then we also know that place matters in terms of neighborhoods, in terms of the state where you live, and that access to social supports, like the ones that Hillary was just discussing, plays a role. Next. So the argument I'm going to make today is that if we want to truly address food insecurity, we have to consider how experiences are not just tied to material resources, but also rooted in racism. And we can start with two points that we know. So we know that people of color are at increased risk of food insecurity. And some of that risk is due to racial differences in SES. Although one thing that's important to point out is that Eduardo Bonillo Silva's point, he is at Duke, that when we control for variables like SES, we risk neglecting why people are over or underrepresented in those categories in the first place. But then a second point is that this increased risk is not exclusively due to differences in SES. Next slide. So the argument I am putting forth today is that, consistent with Lincoln Phelan's work on fundamental cause theory, racism is a fundamental cause of food insecurity. And this theory was originally developed to explain why rich people have longer life expectancies than poor people. And basically the idea is that these disparities persist because upper class people have access to an array of flexible resources that protect their health, even when the specific diseases or risks change over time. Next slide. So I'm arguing that racism is a fundamental cause of food insecurity for two reasons. And one is that racism is a fundamental cause of disparities in SES, and those in turn are linked to food insecurity. The second part, though, is that racism is linked to food insecurity independent of SES, and here it is tied to these flexible resources that vary by race, but overflow the bounds of SES. Things like non-occupational prestige and power, beneficial social connections, and what Lincoln Phelan call freedom, which there they mean freedom to not be surveilled, sanctioned, and imprisoned. So I'm going to give several examples to sort of demonstrate this argument. Next. The first is that there's evidence that racial discrimination itself contributes to food insecurity. And so there's research, including by Ed's team in South Carolina, that finds an association between lifetime racial discrimination and the severity of household food insecurity. You can see this as you look over on this slide. And so there's that, and then there's also some evidence that certain types of food insecurity, for example, from police or in courts, are more strongly linked to the severity of food insecurity than others. Next slide. There is also some research that suggests that food insecurity is linked to exposure to adversity over the life course. So disruptive life events, this would be things like job terminations or involvement with the criminal justice system or mental health institutionalization. Those things are linked, are associated with a significant increase in the odds of food insecurity, especially when they start to accumulate. And people of color are more likely to experience these and to experience more of them. And that in turn is linked to systemic racism. Next slide. Racial inequality is also built into our social structures and systems. And as Tanya Golesh-Boza has noted, racist ideologies and policies are reinforcing. And we can look at food assistance for an example of this. So SNAP and WIC are essential resources, as Hillary was explaining, but the discourse around them and around food assistance is racialized. And as examples, we can look at referrals to former President Obama as the food stamp president, and also proposed restrictions on SNAP that center around these images of Black mothers buying things like steak or filet mignon with their food stamps. In turn, SNAP overall, if we look back over the last decade or a few decades, SNAP and other social assistance programs have become more punitive and more localized, and this exacerbates racial inequalities. And so this is an overall trend, but very importantly, the states with the largest Black populations, which are in the South, have adopted the most stringent policies and the most aggressive sanctions. And so the result is that Black people are more likely to be subject to stricter restrictions and harsher punishments just by virtue of where they live, which states they live in. And as I'm going to show on the next slide, this is not a coincidence. Next slide. So I know there's a lot of maps here, but many of the counties with the highest rates of food insecurity, which you can see in the middle map, are in the South. And specifically, many of them are in the Black Belt, which is named for the Black soil in these places. All the way back in 1901, Booker T. Washington noted that the Black Belt came to mean the cotton-producing counties where slavery was most profitable, and that also had the highest shares of Black people. And they still are the counties in the United States that have the highest shares of Black populations. So this is the region where Medicaid has not been expanded, where cuts to welfare, TANF have been most severe. If you look at the map on the left, the white and gray counties are the worst counties, and they are scattered throughout the country, but many of them are in the Southeast. So these are places and counties that suffer from decades of disinvestment, in short, from systemic racism. And you can see it in spatial patterns of food insecurity. If you look at the map in the middle, 2019 food insecurity rates, and then you look at the 1860 map, which is looking at the number of slaves in these counties, you see that these legacies extend all the way back to the era of slavery. Next slide. So I'm going to give just two more examples. One is the mass incarceration era as an example of how racism is fundamentally linked to food insecurity. The rate of incarceration has more than quadrupled since the 70s, and Black and Latinx adults are more than 5 and 3 times as likely to be imprisoned as white adults. One survey found that people who had been recently incarcerated, of them, 91% were food insecure. And there's also research that shows that parental incarceration increases the risk of child food insecurity and household food insecurity, and that this persists over time. And this is a topic that needs more research, but there's several potential pathways. One is that incarceration increases financial hardship, which of course is linked to food insecurity. It also reduces access to social support, including in North Carolina, where, for example, if you have a drug-related felony from another state, you're banned from receiving SNAP for life. And in addition, incarceration may lead to institutional avoidance of people not wanting to interact with the government or with these programs, even when they are eligible. Next slide. So the last example I'm going to talk about is how mass deportation is also evidence of how food insecurity and racism are linked. So deportation also increases financial hardship, which in turn might be linked to food insecurity. If someone is deported, there's a loss of income, and also there are a lot of costs with that process itself. There's also evidence that the fear of deportation is making people afraid to access social support even when they are eligible. And we see this in quantitative studies that have looked at things like the effect of 287G programs. We also saw it in our qualitative research in North Carolina, where we even heard of people avoiding food pantries in certain counties with Latinx immigrant families because they'd heard that the police set up roadblocks on the roads that led to those food pantries. Next slide. So this is my last slide. What do we do about this? The main thing is that if racism is a fundamental cause of food insecurity, if we're going to eliminate it, we have to go beyond just eliminating poverty, which is, of course, is a huge challenge. We also have to tackle racism itself, which entails making fundamental changes at multiple levels. So the first is to implement broad-scale structural supports that support rather than penalize people. So universal food and social assistance programs that can be implemented at the national level and made available to all people, regardless of immigration or employment status or incarceration history, instead of this fragmented state-based system that leads to some of these inequalities that we talked about. The second is to eradicate interpersonal and institutional discrimination, the kinds of discrimination that some of the people in our study told us they had experienced with social service providers and healthcare providers as well. But this is not sufficient, even though those in themselves are huge challenges. A third thing is to address the economic and social inequalities that racism both provokes and required. Just to give one example, we know that people of color disproportionately work in food jobs as farm workers, as meat processors, as restaurant cooks. And so these are jobs that often don't pay enough for them to feed their families. So addressing this means advocating for better workplace conditions, better pay, better safety standards, but it also requires dismantling mass deportation and incarceration policies that leave workers like this super exploitable. And then the last point is that acknowledging and addressing the role of systemic racism in food insecurity requires centering the experiences and voices of people of color who have long been fighting against oppression. So the right to control food was central to many of these struggles, dating back a very long time, from Fannie Lou Hamer and the Freedom Farm Cooperative to the Black Panthers Free Breakfast Program to Indigenous peoples' fights for food sovereignty and the right of self-determination over their food systems and the land and resources that produce that food. Next slide. Thank you. Thank you very much. I look forward to the conversation between all of us.
Well, thank you to all of our speakers for those great presentations. I'm really excited to lead a discussion with you all now. As Mary introduced me at the beginning of the presentation, I'm Megan Lott, the Deputy Director for Healthy Eating Research, and we are a national program of the Robert Wood Johnson Foundation based at Duke University in the Global Health Institute. So I think each of you had some really great action items you presented at the end of your presentations. And I want to start with a question for Ed in terms of how do we accelerate progress to improve nutrition, especially in light of what you highlighted with climate mitigation and other issues that need to be brought more into the discussion?
Well, I'll answer maybe in two ways. First, in order to make improvements, we need to know what it is that people need, what needs to be delivered to them, if you like, what's missing that would improve their food security and nutrition. We've spent a long time in the field of nutritional sciences learning about that. We also need to know how to generate the political will, the policy commitment to then enact actions and policies and programming that will make that happen. And really, we've only attended to that from a global perspective, really only attended to that over the last 20 years or so. The third sort of leg that the stool that holds this up is knowing how to deliver. And that's where we're only relatively recently even begun to even really try to grasp that. I mean, it was first called out in the Lancet Child Nutrition series, Child Survival series in 2003, and we really haven't made tremendous progress. I mean, if a woman in Zimbabwe, to take a concrete example, gets up before light to travel a long distance to get to a prenatal clinic, waits all day because no appointments are allowed, and then at the end of the day has to go home and not ever being seen, then that really discourages people from even pursuing the possibility. So we really need to make improvements there and help countries be able to do that. In relation to climate change, we're right at the beginning here. I mean, I think in the end, there's going to be good convergence between what we want to see happen in nutrition and food in terms of promoting health and what we need to have happen in terms of promoting sustainability from an environmental perspective. But we're only beginning to have those conversations. And that's kind of where we are. And we're going to have to really put some attention on that.
Great, thank you. I'm going to ask a question now to all of our panelists from one of our attendees. And that is, what kinds of programs do you all think are successful grassroots capacity development projects when larger scale national policies are not reaching marginalized communities?
I'll just start by throwing out one example, which is produce prescription programs or food voucher programs actually started as local grassroots efforts to get money for food to people who weren't being reached by SNAP or WIC or other federal nutrition programs because of immigration status, because of a drug felony conviction, for whatever reason. And because of the success of those local projects, the USDA later came in and started to fund those. So I think that's a great example of how this can start at the local level.
Yeah, I'll just add that, I mean, and we have examples of work that's been done that, for example, we were just finishing the analysis of data from a study that we did in Western Kenya, right along near the coast of Lake Victoria, which is a poor area with a fairly high prevalence of HIV. And the point was to help people develop agricultural livelihoods, to be able to have to basically develop small farms and to provide them with the means to be able to do that. And the project shows really dramatic results on their mental health and empowering them and reducing stigma and a number of other outcomes like that. The challenge is, will that ever be scaled so that a larger group of people benefit from that? And I think one of the real challenges we face, and I think you're almost raising, I mean, the question you raise is really important, and it's almost an ethical, is a moral question, or at least perspective about it is, you know, if the leaders in a country are not willing or able to make a commitment, is it really worth trying to do these things in those countries if what you want is to be able to do it on a large scale? And that's a real dilemma that we face, because otherwise we leave people behind.
Yeah, that's a great point. I want to throw our next question to Sarah. You really provided some good insights into racism being an underlying cause for food insecurity. And I'm wondering if you can talk a little bit about how that argument that racism is a fundamental cause of food insecurity be demonstrated outside of the US.
Yeah, thank you. And a lot of our recent work was in the United States, but I think from the research I've done in other places and what I've read, I think you do see evidence of this. Just to give two examples. So in Mexico, where I've done some other work, poverty certainly is much higher in indigenous communities. Like, you see some of these same kinds of processes. And even in Sweden, which has a lot of the universal kinds of supports that I think we would advocate for, they don't actually measure race as a demographic variable in Sweden. This is true in quite a few countries, but they do measure immigrant status, and you see a lot of the same kinds of health disparities between families with an immigrant background and other families in Sweden. So I think, you know, to see the specific pathways, the specific ways, I mean, some of them are going to apply. The other thing I guess I would say is that some of the things that we've talked about, like the policies in the US, they have effects outside the US. Our trade and agricultural policies affect farmers in rural communities in Mexico. The migration that's coming from Central America and Mexico is directly linked to US economic policies. Then people migrate to the US. Then we see how like mass deportation and changes in how immigrants are surveilled affects whether they're willing to use even the food assistance programs that they might be eligible for example, for their US born children. So I think it requires more research to see exactly what the pathways are in other places, but I think it's very likely that this argument is not unique to the US.
Great, thank you. We have a question.
If I could just add quickly to that, you know, fundamentally, it's about us versus them. It's about people in power seeing others who are different from them in some recognizable way, not treating them in the same way they would treat the people they see as us. And I think Sarah's done a wonderful job of showing us why that matters in the United States. But I agree with her that, you know, in other places it's indigenous versus non-indigenous, or it's immigrants versus non-immigrants, or it's somebody's tribe versus somebody else's tribe. And so that challenge that we all face to not let that happen and not think that way and not let people in power abuse that power to exercise, to distribute resources in such a way that whole groups of people are structurally disadvantaged. That's a big issue, and it's a universal one.
Great, thank you for adding those important points. We have another question from in the room.
I was wondering if you could address the concept of nutrition security and how it's different than food security, and what you think we could be doing to address nutrition security, which really deals with a high quality, nutritious diet.
Hillary, you want this one?
I'll start, you add to it. This is something that that many of us, including Ed and I, have done a lot of thinking about. One of the first things I think we have to understand is that nutrition security is a fundamental component of our food insecurity construct, and that the USDA defines food insecurity not just access to calories, but access to high quality foods that promote health. Nutrition security shines a light on that and focuses on that. And I think there's an important reason for that, and that is that we are living in an environment in the US where, for the most part, access to calories is not the problem, not for all food insecure households, but most, but access to high quality nutritious calories is. And so I think we have to come up with ways of talking about food insecurity and nutrition insecurity that recognizes how much they complement each other. And I think we need to continue to elevate the importance of nutrition within our dialogues about food insecurity, particularly as they ladder up to disparities in chronic disease risk. And I'm sure you have stuff to add to that.
Yeah, no, I agree. And I think, you know, Hillary and I are collaborating with a group at USDA to try to, in a way, answer the question that was asked: is what should nutrition security mean? And I think the reason why it's become prominent now is because there's I would say not necessarily clearly formed, but nevertheless strongly recognized need for something, beyond just thinking about food insecurity, and I think that's why it's assumed prominence, but it's also the case that we as a community of scholars and actors, like, in governmental agencies, not just in the US, but elsewhere, haven't really come to grips with what it should mean, and how do we take a construct like that and then use it in a way that's effective to help move things forward. And that's why we're collaborating on this project, is to try to help move that along.
Great. That's really interesting to know that USDA is having these conversations and undertaking this definition process as well. Sarah, did you want to add anything to this one?
I guess I didn't talk about this much, but I think that the processes that lead people to have inadequate diets are complicated. It is about money and the cost of certain foods, but I think it's also linked to things like, what kinds of foods can you store for a long time if you don't have access to transportation to get to the store? So in terms of, addressing this, it is fundamentally largely about money, like what Hillary said, that we have these programs, we have a lot of evidence that they work. They need to be more generous, more universal, less stigmatized. But one challenging factor is that it's not just about money.
Great. I think we have time for 2 more questions. The next one is from one of our virtual attendees. And what role do you all think the media, so news sources, social media, et cetera, can play in terms of furthering education and awareness in regards to food insecurity? Any thoughts there from any of our panelists?
Well, I can start. I started with some quotes about food insecurity and in the COVID era, and I think that's interesting, because in the US, when we started the discussion about this, advocates were really concerned that if we start using the term food insecurity, nobody will understand what we're talking about. This is 25 years ago. And that we needed to use the word hunger because everybody understood what that meant. And, but we've come a long way, and the media has come along with us. And I think as at least that last quote I showed in particular suggests that there's at least many people in the media who do get it, who do get the picture. And I think that's because the people concerned about this have done a pretty good job of communicating it, and people in the media listen. I don't know, it's not universal, of course, but it does shows that progress can be made in communicating what can be complicated ideas to the public in ways they can understand.
I would say that one thing the media can do, which I think they have done, especially during the pandemic, perhaps, is to communicate that this is not just something that happens to other people, that it happens to people, that it's happening in universities and colleges. We've talked a lot about stigma and shame, and how that prevents people from accessing resources even when they're eligible. In our interviews, a lot of them have been with mothers, and that is an especially deep sense of stigma and shame around feeding children and being able to make sure they have enough. So I think that's one thing the media can do. And then, of course, like one of my examples was how racist discourse contributes to racist policies. So thinking about where those points are, these kind of racist messages we have about food insecurity, and eliminating that is also, I think, very important.
And in the context of the federal nutrition programs, Sarah showed some great headlines of how the federal nutrition programs are stigmatized. But imagine, as an alternative, if the discourse around SNAP and WIC was around something around everybody in the United States is entitled to SNAP if they have below an income. If you aren't enrolled, you should be enrolled. It's good for your health. It's good for our food systems. It's good for the health of your children. And it helps the US to maintain its healthy and productive society. And there is good evidence to suggest that all of that is true. If that's the way we talked about SNAP and WIC, rather than talking about it as a program that's filled with fraud and a program that people are using because They want to scam the system, which is the classic way it's talked about in the media. I think we would have a completely different societal desire to make sure that people had access to food.
Well, thank you all so much for joining us today. And thank you to our wonderful panelists for your great presentations. Just to kind of in closing and bring us back to where we started, we saw from your presentations that world hunger really increased in 2020 throughout the COVID pandemic across all countries. And that was after remaining largely unchanged for the previous 5 years. So meeting the 2030 Sustainable Development Goal of zero hunger is going to be really challenging in light of these changes. And I really challenge all of our attendees to think about what else do we need to know from a research perspective, or where do we need additional investments in policies and programs to really move us in the right direction and hopefully have an impact locally, but also globally as well. So thank you all so much. This webinar will be recorded and available on our YouTube channel in a few days. Again, thank you to our wonderful panelists. We hope you all have a wonderful afternoon.